Tanuan is a very, very nice place. I mean, so many people here, in fact, so many foreigners come over here. Leyte is very significant because, you know, we had the American liberation in 1944. So we have close ties. That is why so many people come over here to stay. It's so beautiful all over the place. This is historic. We have Tacloban, we have Palo, and of course Tanuan. You have gone probably to the beach over here. It's so nice, facing the Pacific. We have only one doctor over here. They may have greater number of nurses over here and medical volunteers, but it wouldn't still be enough. Even if we go to the rural health unit, I mean where the doctors are right now, over here in our community, you can hardly get anything over there.
Well, we had a very interesting visit with Dr. Arlene Santo, who is the Municipal Health Medical Director, and she takes care of over 50,000 patients in the different barangays. They have an outpatient clinic. They have a birthing center that is still functional. Her lab has been annihilated, so she has the equipment except for a hemolyzer, but the lab is non-functional because of the lack of a physical facility. And she's still waiting for the rebuilding. The original plan was to rebuild a two-story building with the outpatient clinic, lab, and the birthing center, but she doesn't know when that's going to happen. So, but I must say that the passion and compassion that these doctors have for their fellow community members in such a tragic situation is really admirable.
Of course, the Philippines has got limited resources as regards these things. Tanuan is composed of about 54 villages, but you can just one doctor for Tanuan alone. Only one doctor. That is why we need you to come over here, do mission more often.
From Manila to Tacloban. Our plant closing altitude will be at 33,000 feet, and flying time will be 1 hour and 5 minutes. For the meantime, just sit back, relax, and enjoy the rest of flight. And for your safety, one seated please fasten your seatbelt. We apologize for this delayed departure. It is due to late arrival of our general aircraft. Maraming salamat po. Thank you very much.
Before I left to the Philippines, I had many mixed emotions about going. I was nervous about the idea of traveling alone, but when I landed in the Philippines, I knew that this experience would be a life-changing one. And sure enough, it was. What I received during my time here in the Philippines was a fresh vision of what I hope to be able to do for others in the future. Prior to the trip, I was also concerned that I would not be able to support the team since I was not a healthcare professional. However, I learned that no matter how old or young you are, you can make a difference. Everyone has something to bring and give over to the mission. I have learned things from this trip that I would not have learned anywhere else.
So I guess it's somewhat to my advantage not being in the medical field. So I can take on all the responsibilities that are, you know, kind of like the in-between stuff, like run an errand here, get some stuff there, because really, like writing stuff down is the stuff. Because really what the people need here are the nurses, and they need to be not wasting time on the stuff that I'm doing, but to actually tend to the people, get the medical, get all the triage, all that stuff. So, you know, so in a way it felt like, well, if there's someone who has to do a restocking of pharmacy stuff, you know, might as well be someone like me.
Since my wife is a OR nurse, which is essential position, that especially when they do the medical mission around here, there's only one job for me left, and then the only thing that happened is Gabiola asked me, he said, can we be your PR person? But somehow I said, okay, if that's the case, which is important, we as a Filipino, we know the dialect, we know the Tagalog, we know the English, so we are more flexible when it comes to that.
I've began to be involved with the medical mission in 1995, and that was in Vigan, Ilocos Sur. I was invited there because I speak Ilocano, and I was called to interpret for the Ilocano population. And I thought that I would just go there and come home. However, that mission has turned my life around. I have learned to live more simply in my life.
We've been a volunteering family. We volunteered for other projects. But this one, we realized na it's my own countrymen. Tapos, I've thought that it's not every day that people are given the chance to give back or be of help to countrymen. So, wow, sabi ko, this is a rare occasion.
Dr. Gabiola has been very prominent in the medical community around Stanford and Palo Alto, and we have a very good long-term friend in Palo Alto who knew her and introduced us. And because the medical mission was coinciding with a family vacation that we had already planned, we simply extended the vacation to include the medical mission volunteer week.
This is my very first time to go to a medical mission, and I think I'm going to be going to somewhere. I met some nice, great people that are willing to help. I mean, all kinds of people. And yes, this is such a rewarding experience for me to be able to help out. You know, I feel so grateful and blessed to be able to do this. I hope I can do this every year. We decided to go to this medical mission. It's because of my mother. My mother is from around here in Tacloban, Leyte. And when she heard that Dr. Gabiola and her foundation was going here, she wanted to come. She's 76 years old.
One of my friends asked me a year ago that they're coming here. Since I'm coming also from, I speak the language from Tacloban, so I'm very unspecial, that big tragedy, that it's so emotional to me. And also, besides me, I left my big family back home in California, so I asked my two daughters, who are also nurses, to join me here.
My sister and I, she's also a nurse, and my other cousin, who's also a nurse, and her parents live here in Tacloban, who is my mother's sister. So we, the four of us, decided to have this adventure.
And this is my first medical mission that I've done. I decided to do this because I heard actually my mom is from Tacloban, and I have some family who was affected with the typhoon, and I just wanted to see the people and help out.
I started looking into Dr. Gabiola's foundation, and wow, you know, she's done a lot for herself, and you know, try to help out these people. I didn't know how humongous it's gonna be. Like, you know, she had all these dentists, the dental, the surgery, the optometry. I thought it was just a medical mission, you know, checking blood pressures, but she was doing much bigger than what I expected.
We have some recipient here that walk in that they can't walk. These are the gout. They got gangrene in their feet, and they got heart problem, and they are stroke. And one of my suggestions is maybe get one or two wheelchairs, so we can provide that, so we can go around a lot easier for them.
A walker could be made easily, a lightweight walker. Even minimally damaged wheelchairs we could bring from home that could be rehabbed here with maybe a new cover or a new seat and be very functional to the elderly who need transport all the time.
We want to provide, maybe sponsor some patients to have dentures, and we will do fluoridization, instruct the patient about oral hygiene so they can improve their hygiene, so they will have a preventative treatment by putting fluoride on their teeth, especially the kids. And yeah, we actually now we give them good process, and we teach them how to do it the right way.
Okay. What I left behind was a part-time job where I still work with my physicians in my local organization in the States doing data analysis and quality reporting. So far I'm not using that much here, but I could foresee the day because in many resource-challenged countries they are using modern mobile technology to make medical records computerized, that potentially that could be one more component in the future where we could, rather than generating a lot of paper to show that we're bringing benefit, we could literally be creating an accessible medical record to the patients over time, so that when they go to the next medical mission or to their local doctor, they'd actually have their records and the medicine list and their history, so that we could build on that over time.
We left behind to be here in the mission is our preparation for us also. What we left is our loved ones, of course our pet, our house, who's going to maintain it, and who's going to mow the lawn, and who's going to clean the house while we're not there. But you know, we're lucky that my children stayed and they took care of the responsibility.
Well, back home, we have a family. We have one child, Jojo and Soka, and the two grandchildren, Lucas and Ronin, Connor, and we really do miss them a lot. However, we feel compelled, me and my husband, to come and join the group to come and help the people.
With the resiliency of our people, we were able to build back then. Making the benchmark of the typhoon, using our experiences of the typhoon, we are expecting to move forward better than before.
Medical missions have a purpose, and it's challenged by the reality. The reality is these problems that the local community have are very long-term and go ongoing. And one of the challenges is, how do you take these resources that come in, are here a week, even though they take a year to prepare, they're here just a week. How do you make an impact that lasts longer? And I think to some extent our ability to bring medicines and leave them here for the local barangay health center or rural health center is one step. And to me, leaving the long-term training and some resources to follow on, any way in which the medical mission can spread its effect over time, the better help that is to the community.
Really, you have to experience yourself. You know, it's one thing to hear stories, to see pictures, but to live it in real life, you know, day to day. We're here every day for, was it 5 days, you know, and just to work side by side, hand in hand with the people, you know, of Tanuan, you know, it's really, you can't, you know, we can tell you the story, show you the pictures, but you have to come here and experience it. You know, do a medical mission, and like I said, you don't have to have a medical background. All they need is people to help. You know, whether it's spending your time or even giving donations of any kind, whether it's monetary donations or even like crayons. You know, that goes a long way to touching people.
Now I'm so happy and blessed. I'm still able to do this thing. Even if I'm an old lady, retired more than 10 years ago, I'm still able to do this thing. My children are so happy I'm doing this.
Of course, I'm gonna recommend to all my, you know, my friends and my family and my colleagues out back home. You know, I'm going to be more active now from now on, you know, get donations, you know, for Dr. Gabriela's foundation. So we can do this, you know, we have the funds to do this every year or every 2 years.
It's been, as I said, priceless, exhausting, nakapagod, body aches, pain, but gratifying. That's the word. It's so gratifying that nawawala yung sakit eh. Pagtulog ko, wala na. Gising ko, okay na naman ako.
And it's not a discovery, but it's very inspiring to find out that the country has so much beauty to see and to even know about. And that's how I have seen the country, the whole Philippines, essentially.